World Bipolar Day is in March each year. According to the Canadian Mental Health Association, more than 2% of Canadians experience bipolar disorder. While there seems to be a common perception that someone is bipolar if they experience big fluctuations in mood, there's a lot more to the disorder than that. In the past, bipolar disorder was previously known as Manic Depressive Disorder, as the word manic was used to represent the highs and exhilaration that would occur in mood, and the word depressive was used to capture the severe shift in emotion that would lead to feelings of severe depression. These severe shifts in mood are still core components of the disorder, even with the name change to bipolar disorder. A manic or depressive state can last for weeks or even months, or manic and depressive states can be mixed together where they cycle back and forth. It should be noted that the highs and lows experienced with bipolar disorder are much greater than someone should reasonably expect to experience, so the net result is that being in one of these states leaves someone unable to cope with daily life. For instance, in a manic state, someone can feel godlike, while during a depressive state, they can feel like the worst person in the world. For today's video, I'm going to briefly describe the common signs and symptoms associated with different types of bipolar disorders, as well as discuss the most common treatment options. Bipolar disorder typically occurs in the late teens or early 20s, and rarely after age 40. There's a strong genetic component to anyone with bipolar disorder. However, extreme stress can contribute to bipolar disorder for someone who has a genetic predisposition for this issue. So let's take a closer look at what constitutes both manic and depressive symptoms so you can get a better idea of what that looks like. During the manic phase, there are over 15 feelings and behaviors that someone can experience. These include feeling euphoric, very exhilarated or elated, feeling restless, demonstrating aggressive behavior, becoming extremely irritable, talking very quickly, engaging in risky activities, having an elevated sex drive, racing thoughts, poor concentration, excessive energy, spending too much money, significantly reduced need for sleep, feeling self-important, worsening judgment, and misuse of alcohol or drugs. Now for the depressive symptoms associated with bipolar disorder. They may include one or more of the following 12 thoughts and behaviors. These include losing interest in daily life, feeling hopeless, changes in appetite, feeling empty emotionally, excessive guilt, suicidal feelings, feeling worthless, chronic tiredness, forgetfulness, problems sleeping or sleeping too much, changes in weight, and concentration problems. Bipolar disorders are typically categorized into different types depending on how people cycle between manic and depressive states. There are three main classifications. First, there's bipolar I disorder. This is the most severe form of the disorder. It involves having manic episodes that last for at least 1 week and depressive episodes that last for at least 2 weeks. There can also be a mixing of manic and depressive episodes, and these can last for months. In the most extreme form of bipolar disorder, there can also be hallucinations and delusions. Second, there's a bipolar II disorder. This is a less serious form of the disorder and can be harder to diagnose. With bipolar II, there are mostly episodes of depression, but occasional episodes of hypomania, which is a milder and shorter form of mania that usually lasts just a few days, but can still impair functioning. And in between the episodes of depression and hypomania, there are usually periods of wellness. The third and final classification of bipolar disorder is known as cyclothymic disorder. This form of disorder occurs when your mood changes constantly and quickly from periods of hypomania to depression. With cyclothymic disorder, you're rarely in a normal mood. This usually begins early in life, and the symptoms are so constant that people often feel this is part of their normal personality. Some people with cyclothymic disorder will go on to develop a more severe form of bipolar disorder, while for others, cyclothymic disorder remains a chronic condition. Please note, the purpose of the video isn't to get into Dr. Google mode and start diagnosing. The goal of this video is to provide education and awareness. If you suspect you may be struggling with bipolar disorder, or you have an older teen who you may feel has this issue, I encourage you to discuss it with a healthcare practitioner, such as a physician, nurse practitioner, or psychologist. If you're learning about someone else, this can be very challenging. Someone who may have cyclothymic disorder or bipolar II disorder could be open to receiving some psychoeducation about these issues. For someone with a bipolar disorder, this is highly unlikely unless you happen to be talking to them during a period of relative stability. But given the severity of the disorder, there can be extreme shifts in emotion, and there's the potential for someone to experience hallucinations and delusions. If that's the case with someone you know, it'd be wise to consider calling crisis response, and they can help determine if an evaluation at the hospital would be the best course of action. So now on to the treatment options for bipolar disorder. Generally speaking, there are two primary forms of treatment, and these include medication and psychotherapy. With medication, the goal is typically to better regulate the extreme range of mood as well as the sudden shifts in mood. In the more severe forms of bipolar disorder, medication may also be needed to reduce and ideally eliminate hallucinations and delusions. The most common medication prescribed for bipolar disorder is a mood stabilizer, such as lithium. But other medications, such as anticonvulsants, antipsychotics, and antidepressants, may be prescribed as well. Given the significant shift in neuropsychiatry with bipolar disorder, it may be very difficult to figure out which medication and dosage will be effective. Personally, I feel that medication is a mandatory component of treatment, especially for bipolar I disorders. Psychotherapy alone isn't enough to manage the extreme range and shifts in mood, as well as the accompanying challenges with thinking clearly. With the psychotherapy component of treatment, psychoeducation is particularly important when it comes to treating bipolar disorder. More specifically, psychotherapy is aimed at making people more aware of the disorder and the importance of taking medication, recognizing early warning signs, avoiding substance misuse, and developing healthy, regular habits. Family therapy can also help educate the family about the disorder as well as navigate the challenges that come with a family member who's contending with this issue. Cognitive behavioral therapy, also known as CBT, is typically the most common form of psychotherapy that's used to treat bipolar disorder. CBT focuses on managing problems by changing how people think, which is the cognitive part of the therapy, as well as how people act, which is the behavioral part of the treatment. CBT aims to change patterns of thinking or behaving that contribute to problems or are ineffective in helping someone cope with an issue. When patterns of thinking and behaving have been improved, people typically feel better and function better. For example, if someone's considering discontinuing a medication regimen that's been highly effective in treating bipolar disorder, the cognitive portion of therapy would help someone to challenge these thoughts by looking at the evidence for why it's important to continue taking the medication regularly as prescribed. The behavioral aspect of treatment would focus on teaching the person to relax their body by using techniques such as deep breathing and improving behavioral activation, which largely involves establishing healthy structure and routine for the day. With CBT, there are 5 key principles which I'll review briefly. First, CBT focuses on dealing with the here and now. Treatment with CBT concentrates on addressing symptoms you're already experiencing now, as opposed to focusing on the cause of the problem. However, this doesn't mean that the cause of the problem can't be discussed, but knowing where the problem originated often is enough to manage or treat the issue more effectively. Instead, identifying harmful and inaccurate thought patterns and learning new skills and strategies is prioritized to help establish new ways of thinking and behaving. Second, CBT usually involves homework. As I just mentioned, one of the primary goals of CBT is to develop and reinforce new skills and strategies. Like any new skill, practicing regularly is key in order to learn something well. Ideally, these skills are mastered and incorporated in the daily routine even after someone has finished attending psychotherapy sessions. Third, CBT is designed to be structured and educational. Typically, there's a format for each session where clients learn new information and skills and are assigned homework. At the beginning of the following session, homework's reviewed to ensure that skills and strategies are learned correctly and effectively. Fourth, CBT is collaborative. CBT treatment involves working with the therapist during each step of the process. This involves identifying and understanding symptoms, establishing and prioritizing treatment goals, and developing an effective treatment plan to help someone achieve their goal. The fifth and final principle of CBT is that it's meant to be time limited. With CBT, session length generally averages between 8 to 20 sessions, depending on the issue's complexity and severity. This time frame allows clients to learn new skills and utilize them effectively. Once this occurs, clients are generally able to manage the issue on their own, although with bipolar disorder, there is a relatively high risk of relapse. In a 2003 study, Dr. Mauricio Toan and colleagues, they found that 40% of people with bipolar disorder experienced a relapse, with this typically occurring when self-adjustments were made to medication or when medication was discontinued altogether. However, the good news in this study is that people are often successful in dealing with symptoms in the long term, as 98% of people who sought treatment for bipolar disorder experienced significant improvement in symptoms within 2 years. So I hope this video was helpful in identifying the signs and symptoms of bipolar disorder, as well as providing information about treatment. If you're interested in learning more about the assessment or treatment of bipolar disorder, please feel free to contact us at Sullivan Associates Clinical Psychology. If you enjoyed this video, like it, share it, and subscribe to the channel. Thank you for watching.